Good health begins with belief and total surrender.
Nowadays, people want to experience the disease and then they want to go for the prevention. You can't prevent at the same time.
Yeah.
Okay, if you already experienced the disease, now you have to go for a treatment. And that time also there is no proper surrendering. Why there is no surrendering? Because the values they know, but values are missing. The first value is that we had already discussed in initial faith, beliefness. That is been missing. Even the good things also we are doing nowadays. The moment we start pranayama and meditation, automatically good awareness gets started in our life.
In this episode of Pro Holistic Health, we are very happy to bring to you health perspectives from Dr. Ashwin Patel, who is the Chief Medical Officer at the Sri Sri Tattva Panchakarma Center here in Bangalore. Over to Dr. Ashwin Patel. Greetings to you, Dr. Ashwin Patel. Greetings from Pro Holistic Health.
Thank you very much for inviting me.
So, Dr. Ashwin, what would you say are the obstacles to good health in today's modern day life?
You have raised a wonderful question in the beginning itself, and I appreciate for that. So there is definitely a cause factor behind all illness, all the disturbance in our life. If you are not addressing it properly, then it will be a miserable our life itself. So better to know the cause factor. Nowadays, whenever we go to the doctor, we are going for the diagnosis, and after diagnosis, we start the medicine. More people are not interested in knowing why it is happening, or even knowing that things, they don't want to implement the certain steps to correct it. Whatever I seen in my practice, the main thing is away from our scriptures, our ancient knowledge, and people are finding the very shortcut thing, and they're always searching for the certain one medicines or one food to correct themselves, which I don't think so anybody will get success, or they have to have some supreme power energy, or they have to be enlightened from the birth. The cause structure behind this is one of the things I told is away from the ancient knowledge. Second is doubtful beliefness in the supreme consciousness.
Right.
Doubtful, I'm telling you. They always search for the scientific evidence behind it. Yeah. There is, unknown world exists. That's why we go for the temple. We do so many rituals process also. It's not necessary that you get the scientific evidence behind it. Yeah, we can do R&D behind it, but whatever is said, it is true. And we have to start with the beliefness. Third thing I know is that people are not aware about their constitution, how their body is made of. They don't know about the food which is related to the constitution.
Right.
You have to be aware about it. Now there's lots of mixture of foods are there. Lots of wrong combination is going on. They are just eating for the taste purpose. And they complain also. And I have seen my practice that people know that I am getting the problem with certain food, but still there is no win on the tongue. There is one quote is there, Jite rasam, jite sarvam. It means literally, if you win on the taste means there is no particular too much craving for that. Yeah, you can eat interesting food also, but not too much craving in that. And another meanings of the Jite rasam means you should have hold on your tongue. So there is two meanings of that. Taste and understanding or speaking. So the food understanding. Third thing is myths are going on about the sleeping hours and all those things. In Ayurveda says there are 7 types of constitutions are existing. So everybody has a different scenario of sleeping pattern also. So we must have to understand about the biological clock. If you heard that in 2007, this last year on 2017, sorry, last year only Mr. Jeffrey, Mr. Michael, they have got the Nobel Prize just to reinvent, we say, for the biological clock, which is already been said in an Ayurveda 5,000 years back only. You just need to believe it. Yeah, it is the knowledge in the Sanskrit. So many people find it difficult to understand, but they can approach to any Ayurvedic doctor. Definitely they will come out to know certain understanding about it. So these are the certain cause factors I am seeing that. Other thing is that approaching the doctors for knowing about their health, even diagnosis for that, and then doing the shopping of the consultation continuously. It won't stand on one place. Sometimes taking too much different opinion, we are wasting the correction times of the disease. Sometimes we are in a hurry to diagnose the disease, where they may diagnose is not even well pakka, we say it's not mature. Giving the name in the initial stage itself, sometimes it leads to wrong treatments or wrong medications also. So these are the main obstacles we are seeing that people has to improve.
Right. So what you would say is basically that first of all, faith is what is missing.
Yes.
So faith, we start with faith and self-belief,
Correct.
and that will go a long way in giving them good relief and good health.
Correct.
As an Ayurvedic Panchakarma center here, Dr. Ashwin, what are the typical cases and health issues that you see here day in and day out, and how do you treat them?
If I speak on the Ayurvedic perspective, there are almost 14,000 diseases are mentioned. Till the modern identity it's reached up to that level. And the terminology is in the Sanskrit, which is, we say, Vak, Pitta. This is our general terminology we use. And the combination of the 7 body tissue, that is called Rasa, Rakta, Mas, Med, Asti, Maja, Shukra. If I say in the English, that's called plasma, the blood, the muscles, the bone marrow, fat, and last is the sperm or ovum. So there is a combinations are there where the certain elements get disturbed. And you know our body is made of the 5 elements, air, space, fire, water, earth. That malfunction or the not proper coordination, that only creating the issues. So in Ayurveda we are treating or trying to balance those things. And for that, in scripture there is a Panchkarma word is mentioned. Where Panchkarma exists for the Vamana, Virechana, Basti, Nashya and Rakta Mokshana. If I say in the English we say Vamana means the medicated illnesses. Virechana means medicated purgations. Nashya means the head evacuation by pouring certain churnas, means powders, oils. There is a Basti means called medicated enema. And the Rakta Moksha is called bloodletting. These are the 5 main purificative process which is given by our ancient saga in the scripture. We follow those in Charak, Shushruta and Vadbhat. They follow their guidance, the Ayurvedic system. They have given certain allied treatment also, where most of the people are aware about the massages. So massage alone is not a panchakarma.
Yeah.
It is just a supporting treatment. We say Abhyanga is a Sanskrit word. Udichiri is a Sanskrit word. Shirodhara is a Sanskrit word again. Okay, so there is a lots of 50-60 allied treatments are there, which basically focus on overall body and the localized body.
60.
Yes, almost. We that much we offer over here also,
Right.
the combination. But before that, advising any panchakarma treatment, we have to see the eligibility. We cannot offer all the treatments to everybody without seeing. For that, in Art of Living, with our blessing of Guru Shri Ravi Shankarji, we took the one initiative to revive the Nadi Pariksha. It has been there before, 200 years before when the allopathy was not existing. We have these tools to examine the people. We see the tongues also, eye also, skin also, blood also, stool and urine. Above that, we see the pulse. It's called Nadi Pariksha. We take the radial pulse and we tell how kind of 5 elements are behaving in your body. And based on that, we diagnose in our terms. Not like diabetes and BP and thyroid and all those. We have our terms called in Vata aggravation, Pitta aggravation, Kapha aggravation. These are our diagnoses. On the basis certain medicines, certain therapies, certain life resilience has already been decided. So we just give the guidance for that to be followed. If problems is just initial phase, I personally recommend to change in the diet. First of all, if you are totally sedentary life, please go and approach for certain yoga and pranayama and all. For that already in Art of Living, you know, lots of courses already been designed and Sudarshan Kriya is a very powerful technique. So you don't have to think, you just go and just do it and follow it. There is more than enough, it is already been given. You don't do R&D unnecessarily. Come and start with the willingness. Surely you find once your breathing is powerful, as you know, the oxygen is the best healer only. Even you go in the ICU, they give the oxygen only. Okay, and let you how your body immune system is responding.
Correct.
So just become aware about the Sudarshan Kriya, aware about the breathing pattern, and then improve your healing system. If by chance some disease is already in the first stage, then we ask them to come and admit themselves. We do advise some Panchakarma treatment along with some meditation, yoga program and a suitable diet also. That is the main part in the line of treatment. which we are offering over in our system. So more of anybody comes, they don't feel that he is being admitted over it. It's not like a hospital atmosphere. We have a holistic approach, and you definitely find that I was not admitted. I was just on a vacation, and I just rejuvenated my body wonderfully.
Yeah, and what they go back with is full rejuvenation of their body, mind, soul. I think they'll be fully.
Most of high percentage of the people, they are having good feedback that we definitely like to come again.
Yeah. So I think the whole approach of yours here is to make them feel as not sick. Make them
Correct.
feel more, just little off balance. We're trying to get you back into balance. Something
We
like
don't
that.
want to create any kind of fear about their suffering disease. It's a certain just imbalance of elements. We are giving the knowledge to focus, not to worry about the situation, and just take a positive steps on it. Okay, so with the, I can say if we are going with the medicines only, we may have to go for a longer time. But adopting the Panchkarma as per the advice by the doctors, you surely 10 times this faster than the medicine support.
So Dr. Ashwin, tell me more about Panchakarma treatments. What are the different types of Panchakarma treatments, and for what kind of ailments are they recommended?
So in my whole nature of my practice, more of the cases which I have seen is related with the depression, anxiety. Nowadays these cases are increasing. Along with that, automatically the associated disease, we say the metabolic disease like diabetes, then hypertension. In ladies, they are suffering with hypothyroidism, more of hormone imbalance, PCOD, uterine fibroids, and later so the cancer also.
Yeah.
That also they will suffer. Some occupational issues are also been going on with the sedentary life, that they have joint issues, more of professional people who continue to sit in the chair, they don't have a movement, they definitely suffer with certain kind of anxiety, lower back issues with spondylitis and all those cases. Nowadays, the children also are coming in a very big number because they are finding the educational space and there is no way of other freedoms. They are almost kept in the one room.
Yeah.
And they are suffering with the suffocation itself. They are not able to express themselves properly. And I think the relation between parents and the children is a little bit,
strained.
There's a distance. The ego is getting too much increased. The children say they are not listening to me. Mother says my child is not listening to me. So unnecessary irritation and anger is going on. So children are facing certain suffocation. So we try some counseling at the same time rather than giving so much medication to them. So here, if you ask particular question, what kind of issues are there and what kind of things we are offering. But before offering that, I must say that doctor's diagnosis is necessary because there are so many people who are not eligible for the direct detox. If you detox, we say you are harming your immunity in certain cases. So we are better to consult a doctor with the Nadi Pariksha to find if you are eligible or not, or how many days is required. You say like a diabetes person, okay, with diabetes we can generalize, maybe even 14 years boy is also suffering with diabetes, 30 years adult also suffering, the old person 70 years is also suffering. Diabetes remain common, but there is a different immune power in each age. So the advising the treatments, line of treatment automatically get changed. One is we have to advise the diet more of, one has to be enrolled with the Panchkarma diet and certain relaxing therapy also. One old person we have to very much take care before doing any repair. So we have different advices for all the issues. This is the asthma cases we do in Panchkarma vomiting process. That is mainly designed or our ancient people has advised to perform this kind of thing. We call kapha issues. So we evacuate the bad kapha from the body and from the chest part. So it helps the lungs to expand properly. It rejuvenates the lung cells, which called areoles, and it detoxify. If any allergic issues are there, it detoxify and you find better. And no unnecessary suppressive chemicals, medicines are required. Okay, and then doing this solution, we again help in that too. So pranayama is always take care. My first priority is to do the pranayama and meditation. That is one line of treatment. Second, as I told, the disease-wise Panchkarma treatments are there, which we generally highlight by the personal consultations only. Okay? But we have so many therapies. If person wants to come for 2-3 days relaxation also, we have therapies. If person wants to treat themselves, we have a therapy. Even nobody says that there is no treatment for any ailment. We have treatment for any ailment. You come over here, you definitely benefit in certain percentage if there is a non-curable disease. But patients do not claim that there is a non-curable disease, I should not happen. That means they are harming more themselves. Better come, stay, living in a calm atmosphere, rejuvenated atmosphere, and very divine energy is also working over here. So, by staying itself, 50% improvement automatically will happen.
So, Dr. Ashwin, today more and more people are realizing the importance of preventive health and the fact that they should not wait for an ailment to strike them. Be more aware and take care of the health and gain little knowledge about health. So, what would be your inputs for such people who would like to increase their awareness about their own health, and what can they do to keep themselves healthy and happy?
Very nice question. I always give a wonderful motto in the beginning itself. Swasthasya swasthya rakshanam aturusya vikara prasamanam cha. What it means that we have to prevent the issues before it enters in the mind level or body level. For that, there is certain treatment types. We can't say treatment, but certain knowledge is already been given. There are scriptures. And then if a person is suffering, then we have to treat him. The first motto itself is we have to prevent. We are focusing on prevent only. There is a 3 words. Adi Devik, Adi Bhautik, and Adhyatmik. 3 words are existing. That literally altogether 3 means to prevent certain diseases before they comes in. That there is a believingness in the spirituality is there. You have to believe in the God also. Okay, you believe in the soul also. This invisible world you have to believe in before questioning it. If you questioning it, you are already delaying certain process of being healthy for a longer time. Okay? So if you see where I am sitting, it is almost a preventing center, I can say. And our Guruji has already taken the lots of initiatives for that. By first he was giving the Sudarshan Kriya itself, it is a preventive measure. It is not just one Sudarshan Kriya, but I said allied treatments, like allied processes all been there together. To make that course entertaining, also giving you preventions, and also diverting you or giving you knowledge for how to be healthy, how to prevent yourself without knowing so many things. Nowadays people try to know so many things, and with the knowledge they get tired, they are not able to implement it. This is what is happening. So they are away from the preventive. Nowadays people want to experience the disease and then they want to go for the prevention. This is what there is a confusion. You can't prevent at the same time.
Yeah.
Okay, if you already experienced the disease, now you have to go for a treatment. And that time also there is no proper surrendering. Why there is no surrendering? Because the values they know, but values are missing. The first value is that we had already discussed in initial faith, believeness. That has been missing. Even the good things also we are doing nowadays. The moment we start pranayama and meditation, automatically good awareness gets started in our body. Our Guruji always quote one sentence: every person is the written book of God. What knowledge are you seeking? Just meditate. So automatically good things will come out. And you always follow the good things only. So that is the first preventive measures. Second thing is, don't be in hurry and try to reduce certain issues immediately. Body only realizes you certain issues when it reach up to 40-50% in your body. Then you will be able to make it out. Then you are able to tell to the doctor. It means the things is gone up to higher level. Just calm down again. Listen to the doctors. Better to consult the Ayurvedic doctor, wherever you like, where you feel better. Consult, but don't be in a hurry to correct it. Just give little time.
Something takes time.
Like if you have got an accident, some bone is broken, you can't say, I don't want to run tomorrow. Wait, there is a 1 month period is there, you have to wait. Same way in every issue, there is waiting is required.
So at the same time, during the time of waiting, have faith and wait.
Believeness, more thing is not fear. That is necessary. And take some herbs, follow the proper dietary regimens, that is also necessary in the preventive aspect. Do visit frequently when you don't have a problem. Just try to be in the nature. When I was a child, I used to go to the village in the vacation time. 2 months. That time I was not aware about health and all. But I find that everything is good because there is a limited food, limited access of the world. Okay, you all have to access the only greenery only. Nothing else. So, and I used to sleep by 7:30. Wake up definitely 4:30. So that timing's also been taken care. These things we have to understand that things that you spend your good timings in this kind of holistic center. You spend some time. There are also a preventive part.
So take the opportunity to go close to nature as and when possible.
Yes. Talk to the nature,
Yeah.
see the nature, observe the nature,
Experience.
be in the nature.
And experience the whole thing.
Experience the nature.
Very nice. So Dr. Ashwin, what would you say is the role of holistic healthcare in India, for that matter, all across the world?
So if you see 10 years before, all the people was totally depend on the one system, modern. It's okay, in emergency everybody find a solution, so they will approach. But giving one solution and creating the 10 problems, I don't think is the solution. Okay? Nowadays we are depends on so many circumstances. We are already making ourselves in a hurry and taking the wrong curry. We are creating more problems. And we are at the same time we are expecting that I am to be healthy on a short period.
Yeah.
I want to live a long life also, healthy life. We all know that there is a warranty period 40 years. Okay, above and all, if you want to live a wonderful life, you have to follow certain rules and regulations of nature. There should not be a chemical dependency. Yes, you can live life with your medicines and tablet also, but you find that I am not living a quality life, and there is everyday fear whether I will wake up or not. The doubt has always been there.
Very true.
Okay, and you always find or searching for the doctors and hospital. This is not the life, right? And nowadays, if you say now using the pathy as allopathy, now doctors are realizing the understanding of the pranayama, meditation, yoga. Now they are putting in the prescription also. That orally they are understanding now. They understand the values of that. Our Prime Minister also took the wonderful initiative as a World Yoga Day. So that also giving you wonderful opportunity to be healthy. Okay.
So Dr. Ashwin Patel, thank you for your valuable time and for your inputs. It's been a pleasure talking to you.
Thank you.
Thank you. Do like, share and subscribe to the channel. Thank you.